everyone. Thank you very much for joining me today for this session on applying industry insights to make an impact on mental health. My name's Isabel Masetti. I'm a health and wellbeing analyst at the Rail Safety and Standards Board, and I'm really excited to be here today to open up this conversation on work-related stress. Okay, so I just wanted to start with the definition of work-related stress. So the HSE define work-related stress as the adverse reaction people have to excessive pressures or other types of demand placed on them. So I just thought it was important to recognise that there's other causes of poor mental health that are not necessarily work or stress related, but that for the purpose of this work, the focus was solely on work-related stress and identifying those work factors that might be causing employees harm. So I just wanted to start by having a look through the data or the lack of data that currently exists on work-related stress in our industry at the moment. So what you can see here is a screenshot from the RSSB Health Insights platform. And this is essentially a data hub that rail organisations can use to view their employee health and wellbeing data. And this essentially helps those organisations to align with the rest of the industry, benchmark their progress and sort of have one place where they can view all of their data. So currently we have 30 organisations submitting data onto this platform, and this will be growing throughout 2026 as well. But what you're seeing here on the screen are the self-reported reasons for sickness absence as a percentage across the whole industry. You may have already noticed we only have one category on there at the moment that's capturing stress, and that is the anxiety, stress, depression and other psychiatric illnesses section, which is at 12.33%. And this is from January, from the start of 2025 up until June. So this has been consistently in the top reasons for sickness absence since we launched Health Insights back in 2022. So it's constantly been an issue within the rail industry. And you can see the other big categories in there being the unknown category at 13% and cough, cold and flu at 15% as well. So I also wanted to present this data as a time series. So this is the same data, but just starting from January 2023, so a little bit further back. And we can see peaks and troughs here throughout the years. This is only focusing on that one category that includes stress amongst the other categories in there. But what we can mainly see here is that our train operating sector have quite a high average, with our whole industry just below it, and then the infrastructure and supply chain at the bottom. And then finally, I wanted to show the cost of sickness absence graph as well, to show how much sickness absence is costing our organisations annually. So these figures are from 2024, and each bar is representing each organisation that submitted this data, and it's colour-coded as well. So the blue bars are our train operating companies, our orange are the infrastructure and supply chain, and then the dark blue is the other category. So you can see the organisation all the way at the left, they're spending just over £4,000 per employee per year on sickness absence, which equates to just over 15 days lost per employee per year. So some quite staggering figures on that graph there. But again, we don't know exactly how much stress is contributing to this, but we know that it's playing a role. And then I also just wanted to bring this back to a more national level. So this isn't just an issue that we're seeing in rail. So the HSE have recently published some statistics that 1.9 million workers in Great Britain are suffering from work-related ill health, and that 52% of these cases are directly relating to stress, anxiety or depression, resulting in 22.1 million days lost in 2024 to 25. So again, some staggering figures there. However, unlike the Health Insights platform, these figures are not rail specific. And again, it's sort of unclear to see how much impact work-related stress alone is having on our workforce. So hopefully that helped to provide some background into why we carried out a deep dive into work-related stress. And over the next few slides, I'll share some of the key findings from that research. So for this deep dive, we started by engaging with our industry groups. So we presented a range of potential topics to explore and asked for input and feedback from those who attended the groups. And then we asked them all to vote on the topic that they felt would be most relevant or beneficial to explore first. And 87% of people who responded ranked work-related stress as their top choice. So this topic was very much sort of led by the industry and supported and shaped by them. And the research itself involved semi-structured interviews with 19 rail organisations from across the different sectors. So we had representatives from train operating companies, from freight and infrastructure managers and supply chain. And the employees who we interviewed were from a range of different roles, for example, some from HR departments or from health and wellbeing teams, but they all had insight into their health and wellbeing processes and their policies and strategies. During the interviews themselves, we explored a range of different topics. So how they collect stress and report on stress data within their organisations, how they identify stressors, how they monitor stress, and any suggestions that they had for improving support in this space. And we then used a thematic analysis to uncover the different patterns and themes that emerged during these conversations. And it's those findings that shaped the outcomes and the findings from this research. And the overall aim of all of this was to explore the current stress management practices that are happening within the rail industry, uncover any barriers to stress management, and then highlight the opportunities to improve. So jumping in to the findings, the first area that we looked at was the stress data collection and integration. So firstly, we found that there was quite a lot of inconsistent reporting. So data such as sickness absence data was collected differently between the different companies who we spoke to, but also within companies as well, which was quite interesting. So for example, we found that perhaps the more siloed areas of the business weren't reporting absences into the digital systems that the rest of the organisation was using. And sometimes preferred to use paper-based methods instead, or no particular method for recording these absences. So that meant that any digital reporting that was happening within the organisation wasn't necessarily capturing the whole organisation. And then this sort of links on to the next point, which is the lack of standardisation. So we found that the categories used to document work-related stress absences varied widely across businesses. So some organisations weren't aware of what categories were being used. Some had sort of hundreds of categories to be able to choose from. Others were able to separate between work-related and non-work-related stress. And then others did similar to Health Insights, where it was accumulated amongst other sort of mental health categories. When data did exist, analysis was often limited or minimal. So we found that typically it was only higher level absence reporting that was happening to senior leaders. So there was a missed opportunity there to be investigating some deeper insights. There was also some gaps in the demographic data. So again, most organisations had the capability there to be able to break their data down by demographics. So things like age, gender, job role, but they often weren't doing this or not doing this on a regular basis to have a look at those deeper insights. Some smaller organisations raised that this was because of GDPR concerns, so they were worried about identifying individuals by doing this, which is absolutely valid. But those sort of larger organisations who would be able to do this sort of deep dive into the data weren't doing so we're potentially missing some more granular findings. We also found some system disconnects, so there wasn't much integration between data sets that existed within organisations. So for example, between HR and occupational health systems was quite a common one, which again just limited that holistic oversight and trend analysis for the whole organisation. A common theme throughout was a reactive approach to stress management, so largely focusing just on an individual basis rather than looking at organisational level prevention. There was also underreporting risks highlighted as a concern, mainly due to stigma around documenting work-related stress as a reason for absence. And then lastly, a lack of leading indicators was raised as well. So mainly that preventative data being missing. So for example, presenteeism, which is essentially working whilst being unwell rather than taking the time off, was highlighted a few times, although it can be challenging to know how to measure presenteeism. It's known to cost businesses much more than absenteeism, which was sort of raised as an area of interest and something that we should be looking at going forwards. So the next theme that we explored was around organisational stress risk assessments. So firstly, we found that only 2 out of the 19 organisations are currently conducting these formal organisational stress risk assessments. And similar to the previous findings, the focus was almost always on individual cases. So this was where line managers complete a risk assessment one-to-one with their employees, and then they track that locally. And that approach then misses, again, that organisational identification of stressors and patterns across the business. The line managers themselves play a really important role in being able to open up these conversations around work-related stress. But a common theme was that many line managers may feel that they're lacking the training or the confidence to be able to hold these conversations. And also that if the employee's source of work-related stress is their line manager, they're then again unlikely to report this to their line manager. So just considering this going forwards and making sure that we're thinking about these challenges. Lastly, the HSE management standards, which are essentially a framework for managing work-related stress, was widely known and believed to be used by all of the organisations who we interviewed. One of its key elements is to actually conduct these organisational stress risk assessments. So there was a bit of a gap identified here between what organisations may think that they are following compared to what they're actually doing within their organisations. And the 2 organisations who are completing these organisational risk assessments mentioned that they needed to tailor it to better fit the needs of the rail industry. So again, I think this is something that we could consider looking at more deeply going forwards. So we also included the link between work-related stress and trauma in this research because the exposure to traumatic events is a recognised and unique workplace stress risk factor. So we thought it was important to include. And we did find some similar findings within this category as well. So firstly, we found that the ownership of trauma reporting processes was often quite unclear. So it was assumed to lie within different areas of the business. So for example, the health and wellbeing team would think that HR were looking at it and vice versa. So there wasn't much responsibility being taken or ownership for managing this data in these processes, and it was either spread between departments or not having sort of that clear person dedicated to owning and being responsible for this data. Again, similar to the sickness absence data, the trauma processes were quite fragmented when they did exist. So over half of the organisations didn't have a centralised system or approach to recording trauma exposure. And again, when this data did exist, the analysis there was quite limited. And this is because, again, the data was stored completely individually. And rarely went beyond the line managers, so it missed that holistic overview of the whole organisation. And finally, we identified support gaps because the exposures weren't being identified on this organisational level. Support was typically only being offered for major incidents such as fatalities or for job roles that were perceived as high risk, so for train drivers. And that meant that everybody else and any other sort of perceived experience of trauma wasn't being accounted for. I did have a look at the 2020 mental health survey data that actually showed that this assumption was not accurate, so that stress and trauma is actually affecting a wider range of roles and a wider range of incidents. So it's important that we are also capturing this. And then finally, cultural barriers were a theme that was raised throughout the interviews as well. So we found that stigma around stress remains quite strong, as I previously mentioned. So employees were often seeing this as a taboo topic and therefore potentially avoiding raising it. And then this was also true for those in the more leadership or policy-making roles, where we found that there was a potential fear of opening a can of worms, where if the exposures were being identified, there was a concern about not feeling able or unequipped to manage what it is that might come up. Again, mislabeled data being an issue. So because of this stigma, stress-related absences potentially being recorded under more culturally acceptable categories, so things like colds, coughs and flus, or back pain, meaning that the true extent of the problem around work-related stress might be a bit more hidden within the data. And then lastly, just considering demographic disconnect. So again, it was raised that we know that rail is typically an ageing white male workforce. So mental health conversations should be tailored towards this demographic. And it needs to be considered when creating this environment of sort of open and honest conversations. And then I just wanted to close this section by sharing a few suggestions that were raised throughout the interviews of how we may move forwards. So firstly, many organisations expressed an interest in understanding how their practices compare to those of the wider industry and what areas they may need to improve on. So the sharings that I find, the findings that I've shared today are quite high level and quite a quick overview, but there will be a more detailed report published soon on the RSSB website, which will include all of the recommendations from this research, which I'll quickly go over next as well. Organisations were also quite keen to see examples of good practice, so to take a more collaborative approach and learn from each other on who's leading on work-related stress and how frameworks have been successfully implemented. And then lastly, mandating stress standards was a common theme. So many of the organisations highlighted that without mandation, stress management practices gets deprioritised to all of the other mandatory processes that are in place. So finally, based on all of this findings, I'll just go through some of the next steps that we've laid out for the industry. So on the topic of the stress data collection and integration, we need a really clear and agreed definition on what work-related stress is that can be used across the industry, and that will then allow us to collect consistent data based on this share metric. We also need to standardise the data collection across the industry, so all organisations are gathering the same information, and that can then make it easier to benchmark and look at progress across the industry. We also need to create a more unified system that combines this HR, occupational health, any other data sets that are existing within organisations, so that we can create this really comprehensive view of the whole organisation. And again, it's really important to have clear communication and training for those who are actually inputting this data. So the categories like sickness absence are being recorded accurately and consistently within organisations and across organisations. Using demographic data where it's possible to target interventions and look at insights on a much more granular level can be really helpful for targeting those interventions. We've started to be able to do this on the Health Insights platform, so hopefully we're starting to lead the way in this, and we'll be able to get these granular insights to look at this as a whole industry. Also starting to think about early indicators for work-related stress, so things like exposures or presenteeism, to prevent issues before they lead to absence. So once an employee is lost to a mental health related issue, it's rarely a short-term absence. So being able to prevent them from going on, from experiencing work-related stress and taking that leave is a really good place to start. And then finally, leveraging external data sources that we have. So for example, ONS statistics or data from the railway mission can really help to put these findings into context. So the next theme around organisational stress risk assessments, we want to shift from a reactive to a proactive approach. So by implementing organisational level risk assessments is a really good place to start to be able to do this. We could explore creating a rail-specific stress risk assessment framework that's tailored to the industry's needs. But essentially, it's moving beyond relying solely on EAP signposting or mental health first aiders, and instead focusing on identifying the workforce stressors before they escalate. So as I mentioned before, not having to rely on treating the symptoms of work-related stress, but actually mitigating it before it occurs. We also want to look at embedding frameworks into leadership objectives. So one organisation that we interviewed has actually already started doing this, and they said it was really helpful to change the question of if we can implement stress management practices to how we can start implementing them. We also want to look at RSSB's role in centralising and benchmarking risk assessment data through the Health Insights platform. So we already have this established platform here, and being able to use that and to optimise it, potentially through centralising this data collection, could be really interesting to explore. And then finally, sharing examples of case studies and best practice across organisations to really encourage this collaboration and learning between organisations. We also want to look at line manager training. So we know that work-related stress should be a shared responsibility. It shouldn't sit solely with line managers. However, they do play a really crucial role in having these conversations around work-related stress. So we want to make sure that they have the skills and the confidence to be able to do this effectively. So training should be provided, and it should go beyond just basic awareness and include practical tools to have these meaningful conversations. And it's equally as important to evaluate this training as well to make sure that it's achieving its purpose on a regular basis. We also need to look at offering alternative support routes for employees who may feel uncomfortable speaking with their line managers about work-related stress, but also practical challenges. For example, line managers who might have in sort of 10 or 20 or 30 or 40 employees to have these conversations with, or they might be in completely different shift patterns. So I think it's important to consider these things as well. So for the trauma reporting processes, we have similar recommendations here. So implementing this centralised reporting system that has very clear ownership and that covers all of the job roles and the perceived experiences of work-related stress is really important. And ideally, having this system combining all the relevant data sets where possible to have this comprehensive overview. Where support services do need to be provided, it's very important that they're trauma-focused and that they're evidence-based. And again, having them regularly evaluated for effectiveness as well. Finally, we do have the RSSB trauma guidance and toolbox. This does exist. It's on the RSSB website and it's available. We need to revitalise this work. We need to make sure that it's fit for purpose. And if it is, this could serve as a really good sort of gold standard for all organisations to be able to use to sort of align this trauma reporting process. And then finally, on stigma, we need to create this culture of openness where employees feel safe to raise concerns around work-related stress. And being able to do this will be really important for making sure that all of the previous steps are meaningful, because without having this culture, without employees feeling sort of safe to report work-related stress, it's going to be difficult to make a change. The RSSB Railway Mental Health Charter is also a framework that exists that's designed to specifically for the rail industry to promote, manage and support workforce mental wellbeing. So it has 5 actions within it. And one of those actions is focusing specifically on reducing stigma. So that's looking at things like awareness, normalising dialogue, personal sharing and supportive policies. But again, reducing stigma isn't just going to be a tick box exercise. So this needs to be a long-term goal and an ongoing commitment that's integrated into broader health and wellbeing strategies. So finally, what will RSSB do next? So the purpose of this research was to provide those next steps and direction towards where we need to go within this space. But we would really value getting your feedback on what recommendations resonate most with your organisations and where further support might be needed. And this work is also informing our 2026 roadmap and work stream. So the health and wellbeing team will be picking up these next steps and recommendations going forwards into 2026. So please do get involved in refining these next steps and let us know if you'd be interested in getting involved in case studies or sharing examples of next practice. So thank you. That's all for the content of today's webinar. Thank you very much for listening, and I am more than happy to answer any questions. Okay, so I can see quite a few questions on my screen, so thank you very much for posting those. I think I'll just jump straight into the first one that I can see. Which is, how can organisations move from measuring stress to actually reducing it? That's a really good question. I think the best place to start with that is by those organisational stress risk assessments. So I think by actually being able to identify what those stresses are, those unique sort of risks and stresses that are in place within your own organisation, understanding what they are, you're then able to put in place the control measures that can then mitigate what those stresses are within your organisation. So I'd say being able to get that clear picture of what your employees, what those stresses are for your employees, and then it will put you in a better position to be able to know what you can put in place to mitigate those. Because I think for each organisation, what those stresses are quite likely to differ. I can also see on there, the next question is, what surprised you the most about stress levels across the rail industry? That's a really good question. What surprised me the most? I think a recent surprise, I suppose, that we had in the data, I don't know if you remember right at the start of the presentation, was the recent dip in our self-reported sickness absence reasons. It is mental health accumulated, so unfortunately at the moment we haven't got data on just stress alone, but I think that recent dip in January was a surprise, and after a little bit of digging we were able to find out that it was due to the change in sample that we had, and that actually those organisations who had submitted data had a higher prevalence of a few other conditions, which kind of changed the scope of the data at that time. But that was a surprise in the data, for me anyway, a recent one that I wasn't expecting. What else have we got on there? It seems as many people use mental illness and stress as an excuse to get away with performing their tasks, which makes it harder for people who really struggle to be believed. How can we tackle this issue? Good question. That's quite a big question to be able to answer as well. I suppose the answer is that we can't always stop that from happening. I know there have been sort of anecdotal conversations within businesses where sometimes this is a concern. I think perhaps the main focus is making sure that the support is there for those who are really struggling, making sure that line managers feel confident and are sufficiently trained to be able to have conversations with their employees who are sort of genuinely struggling, and also uh, sort of getting processes and ideas in place on how to start mitigating the stigma around work-related stress, and kind of understanding the reasons in a bit more depth why employees are going off sick. So yeah, I suppose that's probably the way I would answer that question. I don't have a straight answer for it, but maybe looking at focusing on making sure that the support that's there for the employees who are genuinely struggling is to the best standard. The next question I can see on there is, how do I get access to the Health Insights dashboard? Good question. So we do, on the RSSB website, on the Health Insights page, there are the sort of general industry, a few general whole industry graphs that we have on there. To sort of be able to unlock the whole dashboard for your whole organisation, it would involve actually submitting the data for your organisation so that you can see your own company data, and then also be able to benchmark that against the other organisations in there as well. I would suggest perhaps reaching out to me directly to see if your organisation's already involved, or if not, potentially looking at going through that onboarding process and finding out a bit more about what's involved to sort of submit your data to be able to view that on the dashboard, and to be able to participate a bit more in. We have benchmarking workshops and things like that where all of the organisations come together to discuss findings in the data. I can see another one on there that says, when will the report be available, please? It sounds great. Hopefully it will be available very soon in the coming months. It's been written, it's been reviewed, it's just with our comms team at the moment. So it will be published on the RSSB website within the Health Insights pages once it's ready. It'll probably go on LinkedIn and things like that as well. But if you'd like to be sort of notified when it's available, feel free to drop me an email and I can make sure that I do that. What else have we got on there? How can staff feedback stress concerns and know they'll be acted on? That's another very good question. I think that's probably something that that trust, I suppose, almost gets built up over time. I think making sure that everything's quite well documented, so sort of clear actions with a person dedicated, responsible for actioning that, and perhaps a timeline to go with it. I also think there's sort of less formal ways to feedback and get that information as well. So, for example, the use of mental health first aiders, which I know are sort of within a lot of organisations now. They can be a really good source of data and to understand what conversations are being had within the organisation, and we're sort of finding out where those stresses are and where they might lie within your organisation. Hopefully that helps to answer that question. I can see another one on there. Are we seeing an increase in men talking about mental health? Hopefully, yes. Great question. I think hopefully yes as well. This isn't something necessarily that we can that I'm able to see in the data at the moment. Perhaps slightly going off on a bit of a tangent with that question, but we are going to start looking at demographic breakdowns within the data. So things like job role, gender, and age, hopefully at some point as well, which might be able to help to look at things like self-reported sickness absence for mental health or for stress males compared to females, or in particular job roles, which might help to shed a little bit of light on that question. What else have we got there? What's the biggest cause of stress for frontline rail workers according to the data? I would really love to know the answer to that question. I think this is where this research is kind of heading or directing us towards, to be able to understand this much better. So I think because we only have this accumulated mental health category at the moment, it would be really nice to dig a little bit deeper to find out what those causes are, and being able to actually view that within the data. So I hope, that's sort of been able to come across, is that we'd love to be able to dig a bit deeper and find out what some of those causes are. And again, they'll be unique to each organisation as well. So have a look at what other questions we've got on there. There's some quite big ones on there, so I'm a slow reader. Where do I start with needing to complete an organisational stress risk assessment? That's a great question as well. I know sometimes, and for a lot of organisations that we spoke to, sometimes it can be a bit daunting knowing where to start, and there can be a lot of information out there. I think firstly, familiarising yourself with some of the frameworks that are out there. So one of the main ones that I've mentioned is the HSE stress management framework. So that's quite a well-known and quite well-used one. And again, it's starting with looking at identifying what the risks are and what the stresses are within your own organisation, seeing what the impact is of those, what the prevalence is, and then looking at what control measures you can put in place to try and mitigate those and prevent them from leading to things like absences. And again, making sure that those risks are recorded, somebody has taken responsibility for them, there's a timeline for them. And also, I think it's really important that this is consistent and continuously evaluated. So it's not just something that happens once within an organisation and then that's it, and it's sort of left. It's something to continually review and make sure that it is making an impact. What else have we got on here? Should people management be strengthened to reduce work-related stress and promote better collaboration? Everyone makes mistakes. It's part of being human. So should people management be strengthened to reduce work-related stress? Okay. I think absolutely. I think the more collaboration that we can have, the better. Again, I think this is something else that was sort of highlighted during the interviews, was that I think a lot of people within organisations are maybe feeling slightly siloed within this space and not really knowing what to do, and are really keen to learn from one another and to collaborate on how we can all improve together in this space. So I think the more we can promote better collaboration, the better, really, and the more we can learn from each other, the better. Let's have a look at what else we've got on there. Should a company be liable if an employee develops work-related stress? That's a really great question, and not a question that I feel I'm fully able to answer, to be honest with you. So I'm afraid for that one, I think I might leave that for now, and potentially whoever posted that question, if you're interested and would like to find out more on that, feel free to drop me an email, and perhaps I can pass that on to somebody in my team who would be better experienced to answer that question for you. But it's a really great question, so thank you for posting that. Another one I can see on there is, in my experience, previous employer, all the support mechanisms were in place to support staff other than meaningful training for line managers. This meant that support was reactive rather than proactive and was not managed well. is there a plan to address this potential training need in the rail industry? Thank you for sharing that. That's really interesting that it's aligning with what we found within our interviews as well. So is there a plan to address this training need? I think, yes, going forwards, this is something that we'd definitely be sort of investigating. So it was in those recommendations for moving forward. So I think this is something I know within our health and wellbeing team in our SSB, we'd be able to sort of pick up and have a look at going forwards, and it will be within our work stream. So I think that's everything that I can see on my screen for now, unless there's any other questions. I don't think there are. I think we might leave it there. Finishing a little bit ahead of time, so you're getting some time back, but I can't see any more questions coming up on my screen. So I just want to thank you once again for tuning in. Please do feel free to reach out if you did have any other questions, and thank you very much.